This is Bob Dwyer with the Carbon Monoxide Safety Association. It's April 26, 2020. This CO safety segment will include the examination of a few recent and archived CO Newslink stories to help with our discussion regarding carbon monoxide safety in senior and group living facilities. These facilities and their residents' vulnerability to coronavirus has sadly dominated time in the news with a high percentage of deaths associated with this pandemic. Those living in these senior and group facilities may be some of the most vulnerable people to not only COVID-19, but all other viruses that lead to pneumonia, respiratory and cardiac distresses. They're also more vulnerable to impacts of carbon monoxide at lower levels than a healthy adult might be. This CO safety program is here to help raise awareness, concerns, and safety actions in our senior and group home facilities. From our archives, News 12 Bronx, over a dozen people who lived inside a home that offers mental health services were sent to the hospital Friday night. From our archives and NorthJersey.com, the Flanders Fire Department and Rescue Squad, high carbon monoxide reading leads to evacuation of Mount Olive Senior Citizen Building, evacuated 35 residents after responding to a carbon monoxide alarm. Out of Carbondale, high carbon monoxide levels cancel Healthy Kids Day event. A Healthy Children's Day event at a YMCA was canceled after officials found dangerous levels of carbon monoxide in the building. Well, we just took a quick look at 3 news stories about group homes and carbon monoxide exposure and evacuations. We live in a combustion-based culture. Carbon monoxide exposures are common. But let's take a look at some of the people. Let's take a look at ourselves and how are we vulnerable to carbon monoxide? Some of us are more vulnerable than others. While we know we are all vulnerable to carbon monoxide exposures, we can all feel the impacts. Some of us will feel those impacts a little bit quicker and perhaps a little bit more severely than the rest of us. So let's take a look at why should we be protected and at what level should we be protected from carbon monoxide? Well, as low as possible. If you have any kind of medical conditions, and we'll explore those, we should be protected and alerted as low as possible. And out of our archives from April 20th through 26th, the Columbus Dispatch, more Americans affected by air pollution. Well, here's a good reason. More Americans are being affected by poor air quality. An annual report by the American Lung Association found that 45.8% of Americans live in counties with unhealthy ozone or particle pollution. That's about 150 million people, according to the report released Tuesday. Last year's report had detailed 141.1 million people living in counties with unhealthy air quality through ozone or particulate pollution. Now, these levels of pollution, these will impact our most vulnerable populations. And we see this story from last week. 80% of COVID-19 deaths in these European countries were in areas with high levels of air pollution. This story out of Newsweek. Well, look, people in group homes, they're already weakened immune systems when they come in. And their group homes may be in polluted counties, which compound their immune systems. So vulnerable people live in polluted counties. Now, the last thing they need is carbon monoxide in their system. Well, in this case, out of the Herald, out of Columbus, there was a call about a sick person. Carbon monoxide was discovered by responding medics, and people were tested. The facility was partially evacuated, and at least 10 people showed signs that they were affected by the leak. Now, it sure would have been nice if a low-level carbon monoxide would have discovered that before somebody had to be hospitalized. Let's take a look at protecting ourselves and others in group homes. In another from our archives, WHMI, firefighters discovered carbon monoxide levels as high as 340 parts per million inside the unit. A father and son from South Lyon had to be hospitalized after critical levels of carbon monoxide were discovered inside of their home in a senior housing community. These news stories just emphasize what we're trying to get across in our training. A thorough test of all combustion systems and building interactive components should be performed after CO discovery or an evacuation. Well, a lot of it's preventative maintenance. Walking around with a personal CO monitor. It fits in the palm of your hand, it clips to your belt, it can fit under a smock, it can fit on a tool belt. When we're making our rounds or everywhere we go inside our buildings, that is with us. A pulse CO oximeter, that can help with early detection of problems, even with methemoglobin, where there's problems with medications. The buildings that we're in, some of them aren't new, some of them are older, so there's some building pressure issues we can discover. We have a building scientist come in and do work and help us with problems that can impact our heating systems or our air quality. We should have a low-level carbon monoxide monitor that will help protect the residents and everyone in those buildings. And then we have our heating systems. Let's make sure that everything is working and performing within manufacturer specifications and they're not producing harmful levels of carbon monoxide. Because we're concerned about indoor air, we need to be concerned about outdoor air as well. Sometimes outdoor air gets inside. From the University of Wisconsin-Madison, chemists look for ways to assess and improve indoor air quality. This is from our archives just from last week. In a city teeming with traffic, it's common to smell exhaust and other pollutants on the street. But air pollution doesn't always stay outside. Fluctuations in outdoor air quality can cause changes in indoor air pollution, which can lead to respiratory and cardiovascular diseases, cancer, and can adversely affect pregnancies, according to the National Institutes of Health. And why we really need to pay attention and help protect the people living in group facilities. Nursing homes and care facilities, senior facilities, they come in different shapes and sizes, but they all have specific needs for the people inside. We must have working smoke detectors. And in many states, group facilities must have CO detectors. But let's be smart about this everywhere. Get at least a few low-level CO monitors for the most vulnerable people. Whether it's outdoor air or indoor air, I'll ask you, who's responsible for the air you breathe? And if you are vulnerable in a group home, you may not have a lot of choice in what's outside. You won't have any choice what's outside. And you won't have any choice about what's inside. Hopefully, someone will protect you with low-level carbon monoxide protection. We take a look at our group homes or our own homes. Where is your fire extinguisher? Is it charged and ready? Is it certified and updated? Is it clearly marked as to where it can be found? Do you have working smoke and CO alarms? Do you have one low-level CO monitor for early warning? Does everyone know the escape plan when the fire alarm or CO alarm sounds? At home, does everyone know where to find the fire extinguisher and how to use it? Does everyone know what to do in the event of a fire and what the escape plan is? 14 moved after carbon monoxide leak at assisted living center from WTOP. The odorless gas was detected shortly after 3 a.m. That's a lot of work at 3 a.m. at an assisted living center. Carbon monoxide is an inhaled poison. It displaces oxygen and the hemoglobin in our blood. Now, these are vulnerable people living in group facilities. Poisoning from carbon monoxide can go undetected, though a person may be experiencing the symptoms every day. And in group homes, it's not uncommon for people not to feel well. And if the people working there are not aware of low-level carbon monoxide in the facilities, they may never know that the health symptoms presented by the people they're taking care of are compounded by low-level carbon monoxide. In this news article, carbon monoxide leak at Regina Seniors Residence. There were some tense moments Tuesday morning after a carbon monoxide leak at Regina Village, a senior housing facility on the city's west side. Tense moments. And every time the fire department or an ambulance shows up at a facility's village, those are always tense moments. From the city of Hamilton, carbon monoxide levels as high as 400 parts per million was reported by firefighters. High levels of carbon monoxide cause evacuation of a nursing home. The health effects of carbon monoxide poisoning: it is most commonly misdiagnosed as a flu-like syndrome. And in these healthcare facilities, senior villages, a lot of these symptoms people feel often. So let's check them out. We can measure for carbon monoxide in people. We can measure low levels in air. And if some of these symptoms are continuous and we're not testing for carbon monoxide, please, let's start testing, because it may be as simple as a test. These early low-level symptoms can include nausea, headache, dizziness, achiness, constant stuffiness, changes in heart rate, sinus and head pressure, slower reaction time. Those are just to name a few. The symptoms may vary due to overall health, age, sex, or weight of a person exposed, and how much CO they were exposed to. When inhaled, carbon monoxide bonds with hemoglobin in blood. It displaces oxygen and it forms carboxyhemoglobin. It's quantified in the body by this scale. Traditionally, it's been a blood test. That little dog is in the picture there because if you have a little pet and your dog is feeling sick before you are, and you're not quite sure what it is, or you think that they have eaten something, and you're taken a little bit down with some of the symptoms we've described, that's a really good sign that you may have carbon monoxide at low levels in your air, because the dog will experience it before you will. We're always trying to get this information across. The CO effects on people and animals includes dizziness, headache, confusion, head stuffiness, elevated blood carboxyhemoglobin levels, fatigue, eye and upper respiratory irritation, persistent cough, wheezing or bronchial constriction, increased frequency of angina in persons with coronary heart disease, endothelium damage. That's the inner lining of your blood vessels. They get thinner and thinner the more you're exposed to carbon monoxide. The standard therapy for carbon monoxide exposure requires supplemental oxygen, ventilatory support, and monitoring the heart rate. Higher exposures require hyperbaric chambers to force CO out of the blood, replacing it with oxygen. Now, these are common symptoms of carbon monoxide that we're talking about. We're not trying to diagnose it for you. You have to ask your medical physician or practitioner to test you for carbon monoxide if you think you may have been exposed or are experiencing any of the symptoms of CO poisoning. It starts with a discussion. It can include testing. Traditionally, it's been an arterial blood sample and blood sent to a lab. They can do pinpricks of blood and still send it to a lab. But right now the technology has improved over the years. The pulse CO oximeters, this is something that every healthcare provider should have. And when we're making our rounds, you can see a personal CO monitor hanging from a little zipper pocket up by the chest, and a low-level CO monitor ready to be left behind at the residence. There's a little test gas cup that goes and fits on both of those units. That's something that can be used for testing and verification that the units are responding to carbon monoxide. A little dash of spray, psst, and your low-level carbon monoxide monitor responds, letting you know that there's carbon monoxide verification occurring. Now, if you didn't have that gas and you were walking around with it, it would respond just as quickly if there was carbon monoxide in the air. Only takes seconds, and the gas cup fits the personal monitor as well. A quick dash of certified carbon monoxide gas through the hose on the gas cup, right to the sensor on the personal CO monitor, and within seconds we're verifying that it's responding to carbon monoxide. So we're ready for walk-in testing with our low-level carbon monoxide monitor on our belt, our shirt pocket, on our purse. Leave a low-level CO monitor behind. You can test the low-level CO monitor when returning for scheduled service or when you're making your rounds. You don't have to do it every 6 months, once a year on your monitors. Test the personal CO monitor periodically. You know it's responsive if it's worn every day. You'll know that it's working due to alerting you often enough to the presence of carbon monoxide. This will be hard to believe until you start measuring when you go and take it everywhere you go. Now your home alarm, that's something you should test at least once a year. Your personal monitor that you wear on your belt, the 777 in this picture, you can do that once a week. You could do it every day if you wanted. But just to verify that it's responding to carbon monoxide once a month, you try it, you'll see how it works for you. Well, whether you are leaving your home alarm at home and wearing your personal CO monitor on your belt and taking it everywhere you go, you will find that we live in a combustion culture. And as I've said many, many times, carbon monoxide exposures are common, but let's be ready with our low-level detection for very many reasons. And some of those reasons are that we're all vulnerable to carbon monoxide exposure and poisoning, and some of us are more prone to carbon monoxide impacts than others sooner. When is it best for me to be CO alarmed? When is it best for our most vulnerable? You visit vulnerable people. It is a good idea to measure carbon monoxide when you visit vulnerable people. You can save their life. I could tell you many stories about myself testing for carbon monoxide going way back when I started with stain tube technology, going on into other devices. We found carbon monoxide with these stain tubes in ambient air. We found sick people. It began way back for me, back in the late 1980s, early 1990s. And since then, I have gone through many, many carbon monoxide test instruments, and I continue to look and explore at new ones. This is a partial collection, testing carbon monoxide everywhere I go. I'm Bob Dwyer with Carbon Monoxide Safety. And that concludes our Senior Facilities and Group Living Carbon Monoxide Safety discussion. This is April 26, 2020. Again, I'm Bob Dwyer with the Carbon Monoxide Safety Association. Visit www.cosafety.blogspot.com for carbon monoxide news. Thank you. Let's be safe.